Well, besides Valentine's Day, February is Heart Health Month. Ascension St. Vincent cardiologist Dr. David Curtis offers us an education, if you will, on knowing the risk and knowing the symptoms. Good morning.
Good morning. Thank you for inviting me.
Well, I'm so glad you're here because I think this is one of those subjects where we all maybe think we know something about the risk for heart disease, but when the chips are down, there are probably some things we need to learn. So what are the risk factors we're looking at?
So risk factors for heart disease include high blood pressure, high cholesterol or lipids, tobacco use, family history, diabetes, and some folks, rheumatoid arthritis or lupus or connective tissue disease. These are the big risk factors: hypertension, high blood pressure, high cholesterol, diabetes, and smoking. Those are the big ones.
And they are big ones. Well, what are the symptoms? I know we always hear the symptoms are different for men and women. So how do we know if we're having an event?
So the classic symptom is chest discomfort. We always say chest pain, but most patients tell us it's really not pain. They describe a squeezing or pressure or heaviness in the chest. Some folks, it's a burning sensation, like the worst heartburn imaginable. The chest discomfort can radiate into the shoulders or to the arms or to the neck or jaw region. There can be shortness of breath. There can be sweating, hot sweats or cold sweats. There can be nausea. There can be lightheadedness or passing out. There can be fatigue. There can be skipping or irregular heartbeat.
When we experience any of these symptoms, what's the first thing to do?
So the first thing to do, if these symptoms persist more than a few minutes, is actually to seek medical attention. And I would advise early. That's the idea of Heart Month. Heart disease is still the #1 killer, claiming about 850,000 lives per year. So we want to draw attention to the heart disease, heart symptoms, and get people aware that they can come to the hospital early to be evaluated and checked. If there is heart attack, to take quick action. So.
Well, in the material that I received today, I think I was a little more than surprised about the statistics of the impact of heart disease and heart attacks on women over men.
Yes, there is a higher incidence in women, and the disease is diagnosed in a later age. So men present at an earlier age than women. So the women, when they present, have perhaps the same symptoms, but can also present with just nausea or fatigue or that type of thing. But there is a death rate of 1 in 3 for women with heart disease.
So we need probably more information. So should we just open this discussion up with our primary care physician?
I think the answer is yes. You should start with the primary care physician because that's usually where the best knowledge is as far as the patient-doctor relationship. And most people go at least for an annual physical. And I would advise that, to at least have an annual visit with your doctor. Review your history, have a good examination, get routine blood work, treat the risk factors.
Dr. Curtis, thank you so much for this important information. We're so glad you could be with us.
Thank you so much.